taking care of the viral pneumonia patients. Because right now, especially after the shutdown, when the hospitals created great capacity, they lost millions and millions of dollars. No business can be expected to take those kinds of losses and keep on going. So it's not about elective surgeries, it's about healthcare finance.
Mayor, the order to mandate masks inside of businesses make it more difficult on the.
Well, we do live in a very porous region, so we have people coming in and out of different counties in our region. It always works best when in our region when we are all moving in the same direction and operating in the same direction. I did go see where Fort Bend, I think on yesterday, put in place this masked up order. Galveston has done the same. I think when people look at their own numbers, look at their capacity within their hospitals, look at the number of people who are being infected, then I think the numbers will dictate their actions. What I would advise anybody, do it before you get to the point where the forest is on fire. Okay, do it where you have an opportunity to suppress and to slow it down, so that you don't reach those high numbers.
Thank you. Last cool question. Is it possible to get a COVID-19 test in Houston in a timely manner right now, even for people who are reasonably certain they've been exposed to the virus, due to issues with the city's testing hotline, lack of test availability, and long waits at test sites, even for those who do get through the system? As the city continues to urge Houstonians to get tested, are you aware of the lengthy wait times for tests, and what steps is the city taking to help get people tested quickly?
Like I said earlier, we have 2 major testing sites, but their testing is available in other venues. For those people who are insured, what we recommend is that they actually get tested through their provider. Understandably, some providers will not test unless people have symptoms, but that should be the first line of defense or access point for people with insurance. Earlier, I also mentioned that our major testing sites, yes, they're efficient, but they're not necessarily connected to a provider. So it's not the best case scenario for testing, but just because of the demand and the fact that we're in the middle of a pandemic, we have those testing sites up because we need to know. I want to say, I don't know how many free testing sites there are, but I know that there are over 100 testing sites overall in the city. And if you look at the map, you'll see that they're strategically located throughout the community. So the city really is not even a healthcare provider. We're really functioning in a safety net role here. Any free testing sites we have. City affiliated testing sites are more than 2 dozen. That is true.
2,000?
2 dozen. More than